GPs around the country are the beating heart of our health system. They're one of the key reasons Australia is ranked as #1 in the world by the Commonwealth Health Fund when it comes to healthcare outcomes. But we've seen years of government neglect now, and Australians are finding it more and more difficult to see a GP. But instead of supporting you to see a GP, state and territory governments are failing you. They're taking the easy way out. They're promoting cheap, second-class alternatives rather than putting your health first. By allowing pharmacists to prescribe medicines rather than dispensing them from a doctor's prescription as we're all used to, state and territory governments are following the lead of countries that rank lower on healthcare outcomes than Australia. A fundamental principle of patient safety is separating prescribing and dispensing medications to ensure there is no conflict of interest. But governments are putting profits before your well-being. In allowing pharmacists to prescribe the medicines they sell you, state and territory governments are trampling over decisions of independent regulators like the Pharmacy Board of Australia and the Therapeutic Goods Administration. They're bypassing the processes that exist to protect you. Processes that assure transparency, accountability, and keep you safe. Australians deserve better than this. The AMA wants Australians to get the care they need and the high standards they deserve. So we want state and territory governments to give you answers to some important questions about pharmacy prescribing. We ask state and territory governments, what are you doing to make sure there's no potential conflict of interest in these trials? Why are you blocking some of the most vulnerable women from access to the full range of contraceptive options? Why do you think it's acceptable to shift the cost of paying for medicines from the government to the patient? Why are you ignoring the advice of Australia's medicines regulators in deciding what can be prescribed in a pharmacy? Why are you ignoring the Pharmacy Board in determining that pharmacists can prescribe the medications they sell? When did you determine that your citizens no longer deserve the world-class care provided by GPs? We are waiting for answers. Australians deserve more.